Hi everyone. Today I want to address a pressing public health crisis that has deep roots in our history and our systems: the disproportionately high rates of maternal mortality among Black women in the United States. This issue extends far beyond healthcare because it is a reflection of systemic inequities embedded in our social, economic, and medical structures. It is a crisis of equity, justice, and of humanity. To fully grasp the severity of this crisis, we must understand the data. The United States has one of the highest maternal mortality rates among high-income nations, but what's even more alarming is the stark racial disparities within these statistics. In 2021, Black women experienced a maternal mortality rate of 69.9 deaths per 100,000 live births. That's 2.6 higher than that rate for white women. To put this into perspective, it means that for every white woman who tragically dies due to pregnancy-related complications, nearly 3 Black women face the same fate. These disparities are not new. They've existed for decades, and while other high-income countries have made strides in reducing maternal mortality, the U.S. has moved in the opposite direction. This trend highlights something unique and deeply troubling about the intersection of race, healthcare, and equity in our nation. To solve this crisis, we must address its root causes. These disparities are simply not the result of individual health choices or behaviors. They stem from structural racism and systemic inequities that pervade our social and healthcare systems. Black women are more likely to experience inadequate prenatal care. When they voice concerns about the health or the health of their babies, their pain and fears are often dismissed or minimized. Why? Because historical stereotypes and a legacy of medical exploitation continue to fuel implicit biases within the medical community. But the problem goes beyond the healthcare setting. Social determinants of health, like access to affordable insurance, safe housing, and nutritious food in low-stress environments, play a significant role. Many Black women live in environments that amplify stress during pregnancy, creating a ripple effect that jeopardizes their health and their baby's health. Despite the gravity of this crisis, there is hope. Solutions exist if we choose to pursue them with the urgency they demand. First, we must address implicit biases in healthcare. Medical training programs must incorporate critical racial consciousness, teaching future providers to recognize and dismantle the biases that undermine trust and harm patient outcomes. A patient's race should never determine how their concerns are addressed. Second, policymakers must take action. Expanding Medicaid postpartum coverage has proven effective in reducing maternal mortality. Continuity of care during the postpartum period can save lives, but without accessible insurance, too many women fall through the cracks. Third, we must invest in community-based care models such as doulas and midwives. These providers are often trusted by the communities they serve and are trained to deliver culturally competent care. Studies show that mothers who receive support from doulas or midwives experience fewer complications and better outcomes. Finally, public health campaigns must address broader social determinants of health, ensuring that every expectant mother has access to nutritious food, safe housing, and environments that reduce stress rather than exacerbate it. The crisis of Black maternal health mortality is not inevitable. It is the result of choices made by policymakers, healthcare providers, and society as a whole. But that also means we have the power to make different choices. We can choose to dismantle the inequities that have persisted for far too long. We can choose to prioritize the lives of Black mothers and ensure they receive dignity, respect, and care they deserve. And we can choose action over complacency. The health of Black mothers is not just a matter of statistics or policies. It is a measure of our collective humanity. Let us rise to the challenge. Let us demand better, because when we fight for equity in maternal care, we are not just fighting for mothers, we're fighting for families, for communities, and for the future of our nation. Thank you.